Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and someone living with my own chronic pain for over 30 years. Today, I need to talk about a topic that's been a real sore subject around our house this past week, and that's been my migraines. And it's really hard for me to articulate with my wife sometimes what this is like for me. And it really has been challenging because these migraines, a series of migraines this past week, has been produced because of my high levels of stress and not coping as well as I can psychologically and emotionally. It reminds me that I need to practice what I teach. Unfortunately, a lot of people really don't understand migraines. That's why if you'll go to the link below this video, if you're watching it on YouTube, and go to my personal blog where I've written a whole big section about migraine, about what it is, what it isn't, what are the different types of migraines, and most importantly, what to do when you have a migraine. And this has been very helpful for me to get back to the basics for myself. One of the major tools I need to work on is keeping my stress levels down and coping with psychological, emotional issues in a very proactive manner. And when I don't do that, it's liable to trigger a migraine episode. Now, on the second side, the other thing that's been triggering some of my migraine symptoms has been my allergies have been really bad because of air quality. There's been a lot of fires in California. And the air quality has triggered my allergies, and my allergies have triggered into migraine. So I have to deal with those symptoms too, which means if I'm out, I need to wear a mask. I need to make sure that I don't overexert myself while I'm out. I can't do too much exercise, like walking the dog in across the field that we usually go to if the wind's up and the pollen count's up. That's not going to be a really good idea. So I have to really practice what I teach. I have to really look at the psychological, emotional components of my migraine, talk to people I trust and respect about what's going on for me psychologically and emotionally and stress-wise, which are all the tools I've been using. One migraine episode, however, got to the point where I needed to be in bed with ice and with an eye mask because I had a very hypersensitivity to light syndrome going on, and I was very photosensitive, and I needed to totally have blackout for a couple of hours. In addition, there was a lot of nausea, so that impacts, not eating. So I have to really focus on how I work with my patients, and I was very fortunate I did not go into suffering. I've been living with chronic pain for over 30 years. Migraines only last 4 or 5 years. But I have never suffered with a migraine. I've come close, but I always remember that I have a choice. Pain is inevitable, suffering is optional. And freedom from suffering is every pain patient's right. But it's also our responsibility. We need to be responsible about getting into authentic action. And so please read the remainder of my personal blog at the link below this video and learn as much as you can. So if you're living with migraines or know someone who is, please share this information with them. I put a whole section about migraines in my new book, Freedom from Suffering, A Journey of Hope. And there'll be a link to where you can check that book out also. Remember, it's onward and upward. The sky's the limit. And as long as we have breath, there is always hope. Thanks.